Hello, everybody. Namaste. Good morning, and welcome to day three. Day three of the liver detox program. Today is the Q&A session. How are you doing? Quickly type it in the chat box. जल्दी जल्दी chat box में लिखिए कैसा चल रहा है. Quick check on my audio, video. Audio सही है, video सही है, audio visual. Quick check also. Perfect. Thank you so much. सो टुडेज सेशन इज़ वेरी इंपॉर्टेंट. आज का सेशन बहुत ही इंपॉर्टेंट है क्योंकि आज हम लोग बहुत सारे क्वेश्चन एंड आंसर्स लेंगे. बट फर्स्ट लेट्स डिस्कस एंड देर आर सम गाइडलाइंस अराउंड आस्किंग क्वेश्चंस टुडे. हाउ टू आस्क क्वेश्चंस वो सब हम लोग आज डिस्कस कर लेंगे. बट बिफोर दैट अ कपल ऑफ क्विक अनाउंसमेंट्स. थोड़े से जल्दी अनाउंसमेंट हम लोग आप कर देते हैं, ठीक है. सो लिवर डिटॉक्स प्रोग्राम हैज ऑलरेडी बिगन. वो ऑलरेडी स्टार्ट हो चुका है. हाउ मेनी ऑफ अस आर ज्वाइनिंग टुडे फॉर द फर्स्ट टाइम? कितने लोग पहली बार ज्वाइन कर रहे हैं? टाइप 1 इन द चैट बॉक्स. टुडे इज द फर्स्ट सेशन दैट यू आर डूइंग. ओके, तो हमने पहले एक ओरिएंटेशन किया हुआ है. वी हैव ऑलरेडी डन एन ओरिएंटेशन एंड फ्रॉम 24th विच इज दिस मंडे वी आर डूइंग सेशंस एवरी मंडे, वेडनेसडे एंड फ्राइडे. हम लोग सेशन कर रहे हैं मंडे, वेडनेसडे और फ्राइडे को, ठीक है. आज फ्राइडे है तो फ्राइडेज आर फॉर क्वेश्चन एंड आंसर्स. फ्राइडेज को हम लोग जितने क्वेरीज होते हैं वो लेते हैं और उन्हें सॉल्व करते हैं. जितनी बार हो सके उतने ज़्यादा क्वेरीज वी आर टेकिंग टुडे, ठीक है. बट if you're joining us for the first time and you've not seen any sessions, don't worry. आप आज my audio is okay क्या? Somebody saying audio is going on mute. Yes, okay. So if you have not done the sessions, you can just go to the recordings. आप recording में जाके you can refer to the sessions. Okay, so आज के session का format कुछ इस तरफ से है that you are going to ask questions. You'll ask questions and try and be as descriptive. Don't like short questions. जैसे बहुत सारे लोग एक साथ chat कर रहे हैं ना, तो आप एक ही मैसेज आप टाइम लेके अपना क्वेरी टाइप कीजिएगा. अभी नहीं, वंस दीप्ति कम्स ऑनलाइन तो तब आप क्वेश्चन पूछिएगा अपना. एंड ट्राई टू राइट एज मच एज पॉसिबल. सो डोंट थिंक कि मैं एक वर्ड लिखूं, नेक्स्ट वर्ड लिखूं, क्योंकि इतना सारा चैट जाएगा ना कि आपके क्वेरीज मिस हो जाएंगे, ठीक है. सो टेक सम टाइम, राइट योर क्वेश्चन विद डिटेल. पूरे डिटेल में आप अपना सवाल लिखिए. whichever question will be such that can be taken for everybody, जो सबके लिए लिया जा सकेगा, we will take that question. Okay, but if there are some questions जैसे किसी ने कोई पर्सनल पूछ लिया और वो सबके लिए जरूरी नहीं है, then we might skip that question in the session में हम वो क्वेश्चन स्किप कर देंगे. So if you feel your question has been skipped in the session, आपका क्वेश्चन नहीं एड्रेस हुआ है सेशन में, feel free to send us a message. आप हमें व्हाट्सएप पे अपना क्वेरी मैसेज कर देना and Deepti will answer it to you through our team on WhatsApp. Is it clear to everybody? Type clear in the chat box. There are 3 guidelines, okay? 3 guidelines hai. First is that write a detailed question, okay? That is first. Second is if a question has been answered in the session today, we will not take the same question again, है ना. We want to take more and more questions. तो अगर same ही question बार बार answer करेंगे तो सबका question नहीं answer होगा. तो what will Deepti do? Deepti will say कि this has already been addressed. Please watch the recording. Okay, that's 2. And third is if there is a question which requires personal attention, जिसके लिए personal attention जरूरत होगी, तो दीप्ति जी might skip that question right now. वो question अभी skip कर देंगी and then she'll take it up and then you can send it on WhatsApp. आप WhatsApp पे वो message कर देना and our team will coordinate with her and you will get a reply accordingly. Is that good? सबके लिए ठीक है? Let me check if Deepti ji is also online and then we can start with the session. Yeah, awesome. Very warm welcome to you, Deepti ji.
मेरी शुरुआत हमेशा कप से कुछ पीते हुए ही होती है. पिछली बार भी राइट व्हेन आई वेंट लाइव आई वाज ड्रिंकिंग समथिंग एंड अगेन. एनीवे, हेलो एवरीबॉडी, गुड मॉर्निंग. हाय यामिनी, थैंक यू सो मच क्लैरिटी इन इंस्ट्रक्शंस. So Yamini is absolutely right. Please, आप सब लोग, you guys need to be, aware of the fact that एकदम से बहुत सारे questions आते हैं, है ना. तो मेरे लिए भी देखना और 4 वर्ड्स के क्वेश्चन को आंसर करना विल बी अ लिटिल डिफिकल्ट. try to frame your question in a little more elaborate manner. Okay. And as far as possible, please try and stick to the topic that we are discussing, which is mainly got to do with liver. I know a lot of you will have lots of questions. Someone's already asking me about PCOD, PCOS. Abhi, this is not the platform for it. Okay. I can always answer, but today we'll stick to more about liver related questions. Is that okay? Is that good with everybody? So that it's relevant for everyone. Great. So I think we're good to go. Let's get started. So I'm going through the questions that you guys are putting up. Good morning. Good morning. Whatever you're putting up in the comment section, I'm going to start answering slowly. Okay. All right. Please suggest. I'm diagnosed with fatty liver. That is why you're here. Whatever we are asking you to do, जो आपको meal plan देने को बोला, you keep following that. You're getting an. I mean, this is the idea of this program is that if you have fatty liver, you're already being taken care of. Make sure you are not having ghee with trifla and too much of fats, even good fats in your diet. Your fat intake overall has to be limited. And whatever superfoods we have given, यानी जो भी काढ़ा वगैरह में डिटॉक्स ड्रिंक में दिया है वो सब आपको फैटी लिवर ठीक करने में हेल्प करेगा अगर आप ओवरवेट हैं. इफ यू आर ओवरवेट देन यू शुड आल्सो मेक श्योर दैट यू आर लूजिंग वेट. आई एम रियलाइजिंग इस पे कुछ अपने आप से फिल्टर आ गया. माय फेस इज लुकिंग लाइक आई हैव डन सम मेकअप. But anyway, okay, that was just an observation. Please suggest a good Ayurvedic brand from where we can source the ingredients. Maya ji, we don't really prescribe brands at Habuild. If you've been a member, you would know that we don't really, endorse brands as such. If you look up, depending on where you stay, all right, whichever area you stay in, there will be good brands which are famous in that part of the country. For example, Kottakkal Ayurvedchala, everybody knows of, is a good brand. Okay, it's one of the oldest brands when it comes to Ayurvedic supplements, herbs, etc. If you are somewhere in the northern part or central part of India, there will be other brands like, let's say, I'm forgetting the name right now. Jaisi mere dimag mein aayega, I will definitely let you know. But there are 5-6 brands that are doing a good job. Plus, it's totally okay even if you don't go with a branded thing. Why am I saying so? Because जो ingredients मैंने आपको लेने के लिए बोले हैं, they are not medicines. They are literally powders of certain plants. इसमें कुछ adulteration का बहुत ज़्यादा scope है नहीं. तो if you put it on Amazon, 100 grams का packet or 150-200 grams तक का packet at a very cheap price, you can easily find. Those of you who have access to देसी दवाई की दुकानें, right, देसी दवाई की shops, what I would recommend is that आप अपने area में locally वहां पर जाएं and source your ingredients from there, right? So so Bhumi Amla Kutki and all very, very easily available on Amazon. I don't think anybody should have an issue, especially living in India. I can understand if those of you who are living abroad have a problem, you're not able to find all this. In that case, please go ahead with Amla powder. Totally fine. It's still a rejuvenating herb. We spoke about it in the last session as well, where we spoke about superfoods and herbs for liver health. So you can go with just Amla. Whatever ingredients you find, go with that. No problem. Can a person undergoing liver cirrhosis treatment be given? Yes, they can be given. What will be the best guidance for them and what should be avoided? Chandraji, so best guidance for them is the same thing. Cirrhosis means that the liver damage has reached a point where now it's a bit of an emergency. Will the detox drink help? 110% it will help. General जो fatty liver वगैरह के लिए advice है, cirrhosis में भी वही advice. And more than that, whatever your doctor must have told you about your food intake, I'm sure they must have told you that your overall fat intake has to be very less. A lot of times they almost put you on boiled food. They'll say absolutely minimize the oil consumption. Maybe they'll ask you don't even have nuts and seeds and all that. If you've been told so, and आप जैसे ही कुछ nuts खाते हैं, seeds खाते हैं, आपको एकदम bloating and भारीपन and burps and all start हो जाता है, eliminate that. Just come to simple cooked boiled food. That is the strictest precaution that you can take. Okay, rest the kadha will definitely help. Do we need to eat kadwa khira or kadwa badam? No, you don't have to. In fact, agar khira ya badam kadwa ho, to you should know that there is something off with it. You should not consume it. Okay, like बहुत सारे, especially if you use the native variety of badam, अगर आप गुरबंदी बादाम या जो आपके एरिया में नेटिव वैरायटी है उसे यूज करेंगे, you'll realize उनमें से कुछ कुछ कड़वे pieces निकलते हैं, उनको discard करना होता है. Is this diet plan suitable for all types of people like diabetic, overweight? Yes, it is. Persons with liver is okay now. Can he follow? Also, person whose liver is okay, can they follow this just to clean the liver? Yes, absolutely. For an entire month. आपको कौन सी चीज कब तक लेनी है, this is going to be told to you throughout the program. Till whenever this program runs, you're going to be told. So don't worry. This question about how long to take will be addressed towards the end of 15th day. You are just in the first week of the program. By the end of 15th day, you'll have clarity on what all has to be continued, what all you need to stop. Till then, please continue with it. Don't worry, we will guide you properly on when you need to stop having the ingredients, okay, or the detox drink or other things. You said if there is fatty liver, reduction of weight will be difficult, but doctor suggests to reduce weight when fatty liver is detected. So, yes, see, I'm not saying that you cannot reduce weight. I'm saying that, and I'm not even saying that it's going to be difficult. For some people, they find it difficult to lose weight while they have fatty liver, but that doesn't mean that you don't have to lose weight. These are two different things. There being an impediment or a difficulty in losing weight does not mean that you don't have to lose weight. So obviously you have to keep doing things to lose weight. You may find it slightly difficult to lose weight depending on your lifestyle, sleep, the kind of food that you're eating. That's all that I meant to say. So I hope you're clear. Of course you need to lose weight, right? If it's difficult, easy, does not matter. You have fatty liver and you are overweight, you have to lose weight. If you follow the meal plan guidelines that have been given, you will invariably lose weight, provided you're not staying up in the night till 1 o'clock, 2 o'clock, you're not damaging your liver more, and your stress levels are under control. Is protein leak due to fatty liver? No, I haven't really come across such a condition. Usually, it has more to do with kidney being challenged, with liver, and just with fatty liver protein. And when you are talking about protein leak, I'm assuming your Boliji, what you mean to ask is in urine if there is protein found, right? When you get your urine tested, so it's not got to do with fatty liver. It's got to do with something, if at all you're still finding protein particles, it's something more than just fatty liver. Please explain about hemangioma in the liver. Any special diet? No, there is no special diet. What is this? This is basically a condition where your blood vessels kind of get entangled in the liver and उसकी वजह से एक cyst जैसा बन जाता है. Okay, so अब अगर वो cyst बन भी गया है, even if there is a cyst formation, you keep working on detoxing your liver, वो अपने आप से गांठ खुलने लगेगी if everything is going well. So have faith. Whatever your doctor has asked you to do, continue that. Simultaneously do this as well. Special extra attention you give to the liver. I always say in all my sessions, your body is smart. It knows what it has to do. You have to do two things. Don't come in its way by eating nonsense food. Secondly, give it a little bit of extra push by giving it specific items which will help that particular organ. That's it. Rest, it knows what it has to do. It will make sure it takes the blood to the liver. Blood has everything that it needs to be able to cure that, especially when you're having superfoods and herbs and all. Dheere dheere, this will start getting sorted. Okay, this may take some time, but it will. Amla causing dryness? No, amla does not cause dryness. It can cause slight itchiness to some people for whom sour foods, digesting sour foods is a problem. So, in case amla is a problem for you, like I said, don't have it empty stomach. Mix it with food. Make it into chutney with jaggery and little bit of rock salt. You'll find the recipe easily on YouTube. Or backend team, just make a note. We'll send a recipe for amla jaggery chutney. I'll give it today itself. Okay, so you can have it that way, or if you combine it with main meals, chances are that you will be okay. By itself, amla does not cause dryness. Girl trying for pregnancy, can she take the? No. If you are trying to conceive, please don't take it. Anybody who's lactating, anybody who's pregnant or who's trying to conceive, you have to be under a doctor or an Ayurvedic doctor's supervision to know which herbs also you should be taking. This is only, whatever advice I'm giving is only meant for either general population or for people who specifically are dealing with liver issues. But if you're in the category of being pregnant or you're breastfeeding or you are trying to conceive, please don't have herbs. Some of them will have the effect of creating contractions in the may have the effect of creating contractions in the uterus, or let's say gives you a little bit of diarrhea, you don't want to take that chance, especially when you're not even aware. Let's say you've conceived but it's not come on the reports yet, you don't want to take that chance, right? Don't have any herbs at that point. Okay, unless a doctor has told you so. ओके, मेरे फेस पे स्वेलिंग रहती है, क्या ये लिवर की वजह से है? प्लीज सजेस्ट. इट कुड बी बिकॉज ऑफ थायराइड, इट कुड बी बिकॉज ऑफ लिवर, वाटर रिटेंशन जो होता है, इन्फ्लेमेशन होता है, दैट कुड बी. ये किसी भी रीजन की वजह से हो सकता है, बट यू आर राइट. अगर लिवर ठीक से डिटॉक्स नहीं कर रहा है, या फिर आपका लिम्फेटिक सिस्टम, यानी कि वो सिस्टम जो टॉक्सिन्स को बॉडी से रिमूव करने के लिए, उसको एक जगह से दूसरी जगह तक ले जाने के लिए रिस्पॉन्सिबल है, अगर वो ठीक से काम नहीं कर रहा है, तो आपके फेस पे स्वेलिंग आ सकती है. तो जो मैंने डिटॉक्स ड्रिंक दी है, अगर आप वो लेते रहें, डिनर अपना जल्दी करें, डिनर में प्रेफरेबली दलिया जैसे आइटम्स ही खाएं. एक चीज और बता देती हूँ आपको, जौ का पानी बना के, ठीक है, जौ का पानी 1 चम्मच आप जौ ले लीजिए, छिलका उतरा हुआ होना चाहिए उसका. तो जौ के सीड्स लिए, दैट्स कॉल्ड बार्ले इन इंग्लिश. उसको आप 1 ग्लास पानी में रात को भिगो के रख सकती हैं, आप दिन में भिगो लीजिए, और कभी भी पूरे दिन भर में उसका काढ़ा भी नहीं बोलूंगी, बट एक बार हार्ड बॉयल तक पहुंचाना है. मतलब गर्म करना स्टार्ट किया, जैसे ही वो बॉयल पे आया बंद कर दिया, लेट इट कूल डाउन, छान के 1 आप कप हर रोज पीना स्टार्ट कर दो. और धनिए की और पुदीने की चटनी हर रोज लंच के साथ भी डिनर के साथ भी खानी ही खानी है. विद इन 5 days swelling will come down for sure. With 3 meals, which meal is important? Very good question. इस पे मैं वीडियो भी बना रही थी इनफैक्ट कल परसों ही. सो वेस्टर्न लिटरेचर हमको कहती है, हैव ब्रेकफास्ट लाइक अ किंग, लंच लाइक अ प्रिंस, एंड डिनर लाइक अ बेगर. ठीक है, बट अगर आप इंडियन सिस्टम को देखेंगे, वी बिलीव इन which meal should be the heaviest. Totally depends on, firstly, when are we feeling the most hungry, उसका, बट वी कैन वर्क दैट आउट. ये हम भी डिसाइड कर सकते हैं कि हम अपने आप को सबसे ज्यादा भूख लगने की अपॉर्चुनिटी कब दे रहे हैं. ठीक है, मैंने आप लोगों का प्लान ही इस तरीके से बनाया कि आपको दोपहर के आसपास और एक बार अर्ली इवनिंग बहुत तेज भूख लगेगी. मतलब जिस जिसको लगनी स्टार्ट हो जाए, यू विल नो दैट यू आर ऑन द राइट ट्रैक. आंसरिंग द क्वेश्चन स्पेसिफिकली, सबसे ज्यादा हमारी जठर अग्नि, दैट इज आवर डाइजेस्टिव फायर, इज एट इट्स पीक व्हेन द सन इज ऑन टॉप ऑफ आवर हेड. हमारा सबसे ज्यादा पित्त एक्टिवेटेड होता है 12 बजे से 3 बजे के बीच में. अब आधा घंटा ऊपर नीचे भी कर लोगे तो चलेगा, विच मीन्स 11:30, 11:45 भी खा लिया, या फिर 3 का 3:30 भी कर लिया, कोई दिक्कत नहीं है. बट यूजुअली दिस इज द टाइम वेयर यू कैन हैव द हेवीएस्ट मील. दैट इज वाई इंडियन कल्चर में वी हैव राजमा, छोले, लोबिया, ऑल दीज हैवी टू डाइजेस्ट लेग्यूम्स. आप ज्यादातर देखोगे अक्रॉस ऑल कल्चर्स इज समथिंग विच इज हैड इन द आफ्टरनून. वेस्ट में आप चले जाओ, ब्लैक बीन्स एंड दिस बीन्स एंड दैट बीन्स, वो कभी भी खाते हैं प्रोटीन के नाम पे, कि प्रोटीन जरूरी है तो डिनर में भी खा लिया. नाउ दैट इज व्हाट स्टार्ट्स क्रिएटिंग अ प्रॉब्लम इन द लॉन्ग रन फॉर मोस्ट पीपल. व्हाई? बिकॉज अ डाइजेस्टिव फायर फॉल्स डाउन अ लॉट. इट बिकम्स मंदग्नि टाइप हो जाता है सिचुएशन, विच मीन्स इट्स नॉट एज स्ट्रॉन्ग एज इट वॉज इन द आफ्टरनून. इट बिकम्स वेरी माइल्ड इन द इवनिंग. That is why people prefer having soups, or we like to have खिचड़ी, जैसे मैंने अभी एडवाइस किया, दलिया, लिक्विडी, ऐसी चीजें खाएं रात को जो इजी टू डाइजेस्ट हो, जिसमें पानी का कंटेंट बहुत है. Okay, so breakfast can be a little light. I'm not saying stay very hungry. Keep it light or medium sized. Lunch can be little more than breakfast. Okay, and it can have certain things which are in general difficult to digest. Dinner again has to be the lightest of all. This is the Ayurvedic system. As you go to different countries, you'll have different experts talking about different things. But so far, when I've followed this style with most people, they've seen tremendous results. Okay, so ये एक saying भी होती है, जो एक बार खाए वो योगी, जो 2 बार खाए वो भोगी, और जो 3 बार खाए वो रोगी. अब आई एम नॉट सेइंग कि आपको 3 बार नहीं खाना है, हैव इट, बट ये हमें बात समझने की जो है वो ये है, जितनी बारी आप खाते हैं, जितना फ्रीक्वेंटली खाते हैं, उतना ज्यादा आप बीमारी की तरफ जाते हैं. मोर फ्रीक्वेंटली यू स्नैक, मोर you know, lesser the intervals that you are leaving between meals, more you are becoming predisposed to lifestyle disorders and issues. Okay, so keep your breakfast light, keep your lunch okay, heavyish, up to 75% of hunger. Never fill your stomach up completely. Dinner could be up to just 50% of hunger. If you could have had 4 chapatis, stop at 2, knowing very well that you can have 2 more, but you will still stop at 2. Give it 15-20 minutes, there will be no hunger. Okay, and next morning you will wake up feeling supremely hungry. You would have had a nice, what do you call, intermittent fasting window in rhythm with the sun. That's when the body starts to heal. Okay, all right. Any other substitutes to morning drink or decoction of your morning detox drink? I think the backend team must have already told you so. If you can find all the ingredients, great. If you can't find, just have amla water. Squeeze one amle ka juice into. You can either have an entire amla and have some water with it, or or you don't even have to have water. You can just have an entire amla. Usko thoda thoda sa keep biting into it, chew it, and have it. If you don't want to do that, make juice with one amla and then dilute it with about at least 200 ml of water. Add a little bit of honey, little bit of rock salt. Just have that much. Okay, that's the easiest version that I'm giving you. Those of you who don't have access to amla, fresh amla at all, do the same thing. Just replace amla juice with amla powder, dried amla powder, which you will which will be available easily in most countries, even if you're not even in India. Can we take so many drinks in whole day like detox and amla and haldi even if I'm diabetic? So by the way, all of these are going to work on your diabetes. Firstly, there are not so many drinks. Okay, for the at the moment, go back to the diet chart, the meal plan that we've shared with you. There is one morning detox drink. Evening mein there must be licorice tea. I think there is a somebody reached out to me on Instagram somewhere saying that what is licorice seeds. So if there is a typo, please know there is no licorice seeds. Licorice powder is there. Back in team, we can also make a note in case we've written licorice seeds. We just have to remove the word seeds and make it into licorice powder, 1/4 teaspoon. Okay, so yes, Soumya, all of these things will help you with diabetes also. Only thing, if you want, you can get rid of the beetroot part. Abhi to I don't think we've even given beetroot, but maybe next plan is going to have it. Since it's inherently naturally rich in sugars, you can choose to either completely do away with it or have very little quantity of it. Plus, whenever I'm going to give you beetroot, I will add a little bit of cinnamon powder also so that the sugar levels can be controlled. Despite doing this, if you think my sugar levels are spiking, discontinue, no problem. Morning drink, kutki and all is fantastic. Giloy, kutki, amla, bhui amla, all of them are great for diabetes, just by the way. Can we have a simplified chart for detox drink? And I think it's a very simple chart already. Nobody's really come back saying that it's a problem. So I think it's very, very simple. Whatever you are not able to follow from your side, feel free to replace it with something that you would like. Try to eat by 7 p.m. but have severe hunger pangs. How long should we take the liver detox? Liver detox can be continued for a month. Okay, since so many of you are asking, I'm telling you, you can easily continue this for 30 to 45 days safely. After that, discontinue. Just come down to amla water or amla juice in the morning that you can take entire year without any problems. Okay, giloy also, if you're taking, take up to maximum 3 months. I'm not trying to confuse you here. Look, out of all the ingredients, there are certain ingredients which can be had throughout the year, certain ingredients which I would advise have up to maximum 3 months, some ingredients which you can have only up to 45 days. So I think instead of confusing you right now, allow me to give this to you in writing by before this program ends. You'll have it in writing in front of you right now. For the 2 weeks of this program, you can have this without any fear that anything will go wrong. Okay, once discontinued, when can we yeah, all of this will be answered. If you're feeling hungry after 7 p.m., then keep some sort of soup ready, or you can make almond milk at home and have that. If you have access to very good quality cow milk, you can have that also. These things will keep you full. If you don't want to have any of this, like I said, you can keep a vegetable soup also ready. What is important is that you don't have solid food post 7:30, and try, I don't know what you're eating at 7 p.m., but if your meal is a complete meal, you're not trying to eliminate carbohydrates unnecessarily because you want to lose weight and all that, then chances are that you're going to be okay easily till 10 o'clock, 11 o'clock in the night. I have thyroid, fatty liver, cholesterol, weight, Abhaji, too many things together. This I cannot, if I could answer this in a minute, so many people will start healing in just 1 minute of a couple of words coming out of my mouth, right? So for fatty liver, it's anyway going to help you, whatever I have given. If you have thyroid, please go easy on all the cruciferous vegetables that I have included in the plan. You should have them maybe once a week only, not more than that. Cholesterol will also be helped with everything that I have given. Weight will also come down. Okay, so this plan will help you. Precautions also I have told you. Coffee and tea, can we have during this program? Yeah, you can. If you have very bad acidity, then I would recommend don't. I'll give you one more trick. If you have fatty liver, maybe then don't implement it. But if there is no fatty liver as such, then whenever you're having your tea or coffee, if you have good quality milk, जो दूध के ऊपर मलाई आती है ना, take very little, about 3 grams of malai and add it to that tea coffee. Or take 1 spoon of coconut oil, cold pressed virgin coconut oil, and add that. I'm not making it into that fancy bulletproof and all that. I don't even believe in all that. What the simple science behind this is that when we are having something which has caffeine, it has a diuretic effect. यानी कि वो आपकी इंटेस्टाइन से पानी को निकाल के फेंकने का काम करता है कैफीन. हम और उससे क्या होता है, डिहाइड्रेशन क्रिएट होता है. What is important for us is, with the good kind of fats, we have to constantly keep our intestines lubricated. Because we know that that tea or coffee is going to soak the water out or is going to dehydrate you, what we do is we add just a little bit of cold pressed virgin coconut oil in it, so that at least, even if a little bit of water is going out, some layer of fat deposition in a good way happens in our intestine. And this deposition of fat, very thin deposition of fat, is very good for your intestinal health. Those of you who have constipation or who get constipated because of tea or coffee, you will also start realizing that this trick works for you. And I personally do it as well. Okay, so you can have, remember 2-3 rules around tea and coffee for all your life. In the morning, your body is super absorbent. It's like a sponge which is ready to absorb anything that you give it. That's why we always start our day with warm water, detox drink, whatever, because its absorbing or absorption capability are at its peak. So don't give yourself tea, coffee first thing in the morning. I know it's a very strict ask. A lot of people will say that no, ऐसे कैसा हो सकता है? We are used to this. This is part of our culture. So I'm just discharging my responsibility. Rest is in your hands. So don't have it first thing in the morning. Second, don't combine your tea, coffee with meals. Okay. Why? Because you're going to have a lot of nutrients in your meals, and there is something called as tannins in tea, coffee, which will attach themselves to the micronutrients present in your food. Not all, but a few of them, like iron and all, and they wash it out of the system. तो वो उसको absorb नहीं होने देते हैं. Same tea or coffee, if you have at least 45 minutes, 1 hour, 1.5 hours after having a meal, then this absorption is not going to be impaired. So don't combine tea, coffee with something nutritious. So those of you who are having almonds, walnuts, or anything nutritious with your morning tea, thinking कि हम कुछ अच्छा खा रहे हैं, you are wasting the nutrition if you're combining it with tea. Okay. And third thing, don't have it last thing at night or after 5 o'clock in the evening, because caffeine has half-life of 12 hours, which means it stays active in your blood for 12 hours from the time it gets absorbed, because of which for a lot of you, your sleep may be getting impaired. आपको नींद आने में प्रॉब्लम हो सकता है अगर आप बहुत लेट चाय लेते हैं. तो 4 या 5 बजे तक चाय का कंजम्पशन खत्म, आइडियली बाय 3 o'clock, बाय 3 बजे तक आपको कैफीन खत्म कर देना चाहिए. ओके, सो अगर आप ये रूल्स भी ध्यान रखते हैं, यू आर गोइंग टू बी मच बेटर देन 90% ऑफ पीपल इन दिस वर्ल्ड. आज थोड़ी हिंदी में भी बोलो. गीतम जी, आपको पता है जब मैं हिंदी में बोलती हूँ तो मेरे पास इतनी रिक्वेस्ट आ जाती है, इधर उधर से इंस्टाग्राम भर जाता है मेरा पूरा, प्लीज टॉक इन इंग्लिश, टॉक इन इंग्लिश. whenever I'm talking in English, तो फिर मेरे को रिस्पॉन्स आता है आप हिंदी में भी बोलिए. तो मैं पूरी कोशिश करूंगी कि मैं दोनों लैंग्वेजेस में बोलने की कोशिश करूं. लेकिन क्या होता है ना, जब कोई चीज एक्सप्लेन कर रहे होते हैं तो वो थोड़ा सा खिंचती है बात. उसी बात को पहले इंग्लिश में फिर से हिंदी में बोलने में कभी कभी थोड़ा कंफ्यूजन होने लगता है. ठीक है, तो प्लीज माफ कीजिएगा अगर एग्जैक्टली मैं इतने विस्तार में हिंदी में ना बोल पाऊं जितना इंग्लिश में बता रही हूँ, बट I am going to try my best. If no fatty liver, then also can we follow? Yes, you can. Still, there is no problem. Is liver problem genetic? Can be, but more than genetics, Medha ji, you should start believing in epigenetics. ठीक है, तो problems occur, there's something called as becoming, you are being or you are predisposed to certain issues, which means that because your parents, grandparents had that issue, you are likely to get it. Your genes are molded in a way where they can easily catch the issue. But 80% of still, whether you will get the issue or not is in your hands. If you know my parents have diabetes, if you know my father or xyz had a liver issue, you start becoming extra careful with that. And when you do that, you will realize that if they got it around 40 or 45, you will not get it till 70, 75, because you've taken all the precautions. So what has happened, जो हमारे अंदर genes होती है ना, the genes that we have, the genes are not active at all points of time. They can lie dormant. Only when we do certain things knowingly, unknowingly, out of laziness, we create an environment where those bad genes get activated. So you keep them dormant by not giving them an environment to manifest into what they are capable of doing. Okay, so yes, it can be genetic, but despite that, it's in your hands whether you are allowing it to manifest or not. This goes even for type 2 diabetes. ओके, बहुत सारे लोग सोच लेते हैं वो तो था हमारी फैमिली में है इसलिए हमको भी हो गया। नहीं, आपने होने दिया क्योंकि आपने ध्यान नहीं रखा, और आप जस्ट लाइफस्टाइल से टाइप 2 डायबिटीज को बहुत, टाइप 1 आई कैन टोटली अंडरस्टैंड इज कंप्लीटली जेनेटिक, टाइप 2 इज योर रिस्पॉन्सिबिलिटी. Okay, I'm 31 years male. My SGPT 42, SGOT 35, ratio is 1.0. पूरा आपने तो रिपोर्ट कंसल्टेशन ही कर लिया. So it's not just SGOT, SGPT, Ratanji. Good if these are okay. I need to look at the reference range also. I don't remember right now कितना होना चाहिए. But overall, I mean, if it's within the parameters, then I guess it's fine. But अगर वो हल्का हल्का सा ऊपर बढ़ा हुआ है, like if the range is up till 30 something and you are in your, for you it's going up to 40 plus, then this is a sign that there is liver enzymes are elevated, which means the liver is going out of whack. Start having the liver detox drink, it will start coming down. SGOT, SGPT तो मैंने 100 से ऊपर रेंज में आते हुए देखे हैं. Like when people started with a regime or when they first come, it's literally beyond 100, and such bad symptoms of rashes on the body, urticaria, and bhook nahi lag rahi, acidity, and then within 3 months it comes down completely in range. One of the easiest things to work on. Okay, even if it's out of sync. Is basin not allowed if I have a kapha prone body? With kapha, basin is not so much of an issue. With pitta, it is. Okay, so basin is made from chana ultimately. So if you check in my plan also, I don't give basin. Though nutritionist dietitians बहुत बेसन चीला वगैरह खिलाती हैं, in general मैं नहीं देती बेसन इतना, because food has to be looked at beyond protein, carbs, and fats. We have to look at what happens to it when it's getting digested and absorbed in the system. So if something has a tasir which is a little acidic, which all legumes have, by the way, most of them, then I know that most of you here who've come for the program, if you have a liver issue, Monday we'll discuss this in more detail, most of you have elevated pitta. So if the pitta is elevated, I have to give you things which will bring it down, pacify. Basin unfortunately may increase it. Okay. So once in a while is okay, not so much of a problem. But very regular basis पे protein के नाम पे everyday basin हो रहा है. If acidity नहीं है चलेगा, और अगर acidity है तो ये मत करना फिर. Don't do it. Can we take Kapiva liver care? Yes, you can. Good morning. I'm having alcoholic fatty liver grade 2 with the suggested drink and the meal plan. Yes, absolutely. And at the same time, if it's alcoholic, मतलब आपका alcohol consumption आपका है, अगले 3 महीने आप मत लीजिए अल्कोहल. ठीक है, 30 ml भी नहीं लेना है कि थोड़ा सा हो गया, थोड़ी सी पार्टी थी, मना नहीं कर पाए, वो सब नहीं होना चाहिए. मतलब इट्स अ नो मीन्स नो, चाहे दुनिया भर की उधर हो जाए, कोई कितना भी फोर्स करे, अगर प्रोटोकॉल फॉलो कर रहे हैं. अब ऐसे मान के चलिए अभी जो कुछ जमा हुआ है लिवर के अंदर, वो ड्रिंक एंड ये सारा रिदम आपको उस सारे डिपोजिशन को धीरे धीरे उखाड़ रहा है, और आपने एक दिन सोचा चलो कोई बात नहीं 30 ml से तो क्या होगा, और वो वापस से आपकी 10 दिन की मेहनत मिट्टी में मिल जाएगी अगर वो वापस से डिपोजिशन होना स्टार्ट हो गया. ठीक है, तो 3 months कैलेंडर बना लो, क्रॉस डालते रहो एक एक डेट पे. बस 3 महीना 90 दिन में अल्कोहल को नहीं छूंगा, उसके बाद we'll see what happens. एक बार रिपोर्ट सामने आएगी, अपने आप से विल पावर आपकी बढ़ जाएगी कि ये मुझे करना ही नहीं है आगे से, या फिर आप बहुत कंट्रोल्ड अमाउंट में ड्रिंक करेंगे. ठीक है, Is the paralysis patient, can they take liver detox drink? It's a little difficult for me to answer like that because I don't know what sort of paralysis, why this paralysis happened. So I would recommend, if you can consult, uh, an Ayurvedic doctor, you can. Although honestly, most of the ingredients are absolutely harmless. भूई आंवला की क्वांटिटी भी आप ऐसा कीजिए, बिल्कुल एक चुटकी कर दीजिए, मानसा जी, and I think it should be fine. Okay, it's not a problem, but observe their symptoms. They should not get low blood pressure. It should not lead to any kind of diarrhea, etc. Otherwise, from my side, honestly, I don't think there is anything controversial also in this drink, so it should be okay. But if you've been told by the doctor to avoid certain kinds of things because of the kind of paralysis it is, then it's left to you. How does gallbladder removal affect the liver working? Good question. So it doesn't affect the liver working per se, but what happens is, so you need to understand what the gallbladder is doing. Your liver is producing bile, and then it keeps dropping into the gallbladder. Okay, little. Imagine 1 ml drop, 1 ml drop, 1 ml drop, and it gets concentrated into, let's say, 25 ml bile. Okay, this is what the gallbladder does. Gallbladder is just storing the bile which the liver has produced. एंड देन देर इज, वो चलिए साइंटिफिक प्रोसेस छोड़िए, फाइनली क्या होता है, अब ये इकट्ठा हो गया गॉल ब्लैडर में, आपने जैसे ही द मोमेंट यू हैव फैट्स, आपने पूड़ी खाई, आपने घी से भरी हुई कोई चीज खाई, नॉर्मल खाना खाया जिसमें फैट्स थे, वो आपके पेट में पहुंचा, पेट ने अपना जो काम करना था किया, उसके बाद पेट ने उसको इंटेस्टाइन्स में भेजना स्टार्ट किया। जैसे ही वो इंटेस्टाइन्स में गया, गॉल ब्लैडर को मैसेज पहुंचा, बाइल रिलीज करो, कॉन्सेंट्रेट जो तुमने 25 ml कॉन्सेंट्रेट करके रखा अपने पास, निकालो उसको, ताकि हमारा फैट डाइजेस्ट होना स्टार्ट हो। पेट में फैट डाइजेस्ट नहीं होता, फैट का डाइजेशन स्टार्ट होता है इंटेस्टाइन्स में। तो गॉल ब्लैडर अपना खोलता है डक्ट और वहां से बाइल निकाल के इंटेस्टाइन्स में भेज देता है, उससे आपके फैट की डाइजेशन स्टार्ट होती है। अब गॉल ब्लैडर क्या कर रहा था, 1 ml को इकट्ठा कर करके 20-25 ml बना रहा था। ये सब मैं हाइपोथेटिकल एग्जाम्पल सिचुएशन बता रही हूँ आपको। अब हमारा गॉल ब्लैडर रिमूव हो गया है, तो व्हाट इज हैपनिंग इज दैट बाइल को कॉन्सेंट्रेट करने के लिए वो पाउच जो था दैट इज आउट, सो योर बॉडी कैन नॉट कॉन्सेंट्रेट द बाइल। सो क्या होता है, वो लिवर से थोड़ा थोड़ा निकल के ड्रिप ड्रिप ड्रिप, इट कीप्स फॉलिंग ऑन टू योर इंटेस्टाइन्स, एंड जब वो थोड़ा थोड़ा गिरता रहता है ना, तो कभी कभी वो बॉडी को समझ नहीं आता है मैं इतने छोटी छोटी क्वांटिटी का क्या करूं इस वक्त पे, ना तो खाना गिर रहा है स्टमक के अंदर, इन द सेंस समझ लीजिए आप खा नहीं रहे हैं, ये सब कॉन्सेंट्रेटेड बाइल तो खाना खाने के बाद डिस्चार्ज होना था ना। अब क्या है, क्योंकि वो स्टोरेज पाउच नहीं है, वो सारे टाइम ड्रिप ड्रिप करके गिरता रहता है, तो उससे कई बार कई लोगों को एसिडिटी या डायरिया और इस टाइप के इश्यूज गॉल ब्लैडर निकलने के बाद हो जाते हैं, बट मोस्ट पीपल आर एबल टू लीड अ हेल्दी लाइफ। एंड अगर स्टोन का साइज बहुत बड़ा हो तो रिमूवल जरूरी होता है, गॉल ब्लैडर की सर्जरी जरूरी होती है, ठीक है। तो लिवर पे कोई खास फर्क नहीं पड़ रहा है, डाइजेशन पे थोड़ा दिक्कत आ जाती है, बिकॉज अब कॉन्सेंट्रेट नहीं हो पा रहा है, जितना बाइल एक बारी में चाहिए उतना नहीं कॉन्सेंट्रेट हो पा रहा, तो आप अब शायद तला हुआ खाना और ये सब अच्छे से पचा नहीं पाएंगे, क्योंकि वो तले हुए खाने को तोड़ने के लिए, टू बी एबल टू ब्रेक डाउन द फैटी फूड, द अमाउंट ऑफ बाइल दैट वाज नीडेड, body is unable to concentrate that together. Okay, that's why the doctor tells you after the gallbladder surgery that don't have anything which is extremely fatty in one go. Have only little servings of fats, if at all. तो आपको controlled amount में fats का intake रखना है. I hope I've been able to explain this. Okay, do we follow the plan even without fat? Yes, you can follow even without fatty liver. There is no problem. Is it Hi, it is not easy to find the individual ingredients for liver detox drink in Singapore. Can I just drink Kapiva's? Yes, Soumya, you can do that. No problem. I am in Singapore. You will find triphala powder though, right? So make sure you're having that because that also has a good impact on the liver. 31 years male. I've already answered this. Can we use aloe powder instead of pulp? You can, but something which has been dehydrated, which actually came as a liquid by nature, must have lost so many properties by the time it was condensed into a powder. Okay, so if you can, if it's still possible for you, arrange for fresh juice. Okay, like when I get my aloe vera, it's literally from the garden. Or even if I don't have a garden, I'll grow it in pots. I'll take one stem. I'll allow the yellow part to drip for 15-20 minutes. I'll store it in the fridge if required. And take little part, scoop it out and use that. If not that, then maybe a good brand like Kapiva ka jo hai, they have their not tulsi, I'm sorry, Rajasthani aloe vera juice also. You can have something like that too. But agar ye sab nahi mil raha hai, so even powder is then like should be your third preference. Okay, then it's okay. I'm having piles, fissure problem. Can I go with the morning detox drink or what can I avoid? Please guide. So, I don't think the morning detox drink is a problem. Reduce the amount of bhumi amla to a pinch. Okay, and you can have it. Aloe vera, in fact, will help you with the piles, fissure issue. And I'm going to talk about more things which will more things which we're going to add. They will all help with piles fissure. Usually piles fissure is a pitta aggravation issue. Okay, so I for now I don't think the drink is a problem. Like I said, reduce just bhui amla quantity and it's good to go. And if by any chance if you have the drink, anybody is getting or you are getting a burning sensation, remove everything, just add normal amla, about 15 to 30 ml amla juice, aloe vera juice, honey, and water. That's all. Okay, this is for everybody. Is it okay if I get bhumi amla in roots? Is it okay to get it in done powder in mixer and take it? So bhumi amla you can take just roots, but it's उसके सारे 5 तत्व यूज होते हैं, right? That's what bhumi amla is famous for. That उसका fruit भी, stem भी, leaves भी, roots भी और flower सब कुछ होता है. But if you're not finding everything, then it's okay. Go with just the root part. No problem. Meal plan links, please. Backend team, somebody is asking for meal plan links. Good morning. Is morning liver detox good only for those who have, for everybody? Everybody can have it. I'm careful about what I've prescribed. So it acts as a general tonic, and of course, anything which has ingredients in it which are strong. Firstly, the quantity that I've given to you is very less, so it won't create a problem. Even after that, it should be had for a limited duration. So, which ingredient can be had for how long? I will give it to you in writing so that there is no problem. For the next 15 days, all of us can safely have it unless anybody is feeling a little acidic, there is irritation, then discontinue, come down to just amla and aloe vera. If even that creates an issue, stop that, just come down to aloe vera, forget about amla also. If even that is not suiting, तो भाई फिर आप आयुर्वेदिक डॉक्टर के पास जाइए, आपको आपका पित्त बढ़ा हुआ है बहुत ज्यादा. Okay, for good morning, how many days can, yeah, I've already answered. On daily basis, on alternate days, autoimmune is due to liver. Prabjot ji, autoimmune disorder is not directly due to liver, it's due to a leaky gut syndrome. So leaky gut is basically there are holes in your intestines now which are bigger than they should be, because of which certain protein particles and other things are leaking into your bloodstream. So if your intestines are supposed to be tight like this, they've become like this. So you see the holes, the gap between the fingers. Through these gaps now, protein, undigested protein molecules or other things which were part of your food, they are seeping into the blood. So what is the root cause? The gut ka mesh has become loose. This is very commonly on YouTube, Instagram, you'll see videos on leaky gut, right? This is what leaky gut is. What do we have to do? We have to tighten this back. Is it possible? Absolutely possible. Do you have to work hard for it? Yes, you have to work very hard for it and you have to be patient, but it is possible to treat leaky gut. Okay. Now, when this leaky gut happens, lots of things go into your blood. Now, from here, it could be any kind of autoimmune, depending on which part of your body, let's say, is, I can say, genetically or inherently weakest. For some, it will be the thyroid. So then what will you get? Hashimoto's thyroiditis. If it's your skin, you'll get some kind of autoimmune issue with the skin. If it's something else, stomach or any other part, you will get an issue which is called an autoimmune issue with respect to that organ. And all of these issues will have fancy names. Okay. And they're right also. But everything comes down to you having a leaky gut. So until you fix that, अनफॉर्चुनेटली मोस्ट थिंग्स आपको जो कन्वेंशनल ट्रीटमेंट होता है दैट इज यूर आइदर पुट ऑन स्टेरॉइड्स और यूर पुट ऑन एंटीहिस्टामीन्स, राइट? दीज आर ऑल कंट्रोलिंग सिम्टम्स. फॉर सम टाइम you'll feel okay, but it's going to come back, and then you have to keep increasing the dosage of these medicines. So you have to heal the gut, right? So it's got to do with the gut, but gut does not work by itself. Reason behind leaky gut could be a weak liver also, that it's not doing its job properly, because of which intestines are struggling too. So it's everything put together. मेरे लिवर में सिस्ट डिटेक्ट हुआ है, क्या कर सकते हैं? जो अभी दिया है वो आप यूज कीजिए, और भरोसा रखिए कि अगर एक सिस्ट कहीं पे बन जाता है तो उसका मतलब ये नहीं है कि वो अपने आप से हील नहीं हो सकता. जैसे मैंने अभी पहले भी बताया, जो अगर दवाइयां दी गई हैं जरूर खाइए, लेकिन अगर आप अपने लिवर पे अंदर से काम करेंगे, लाइफस्टाइल अच्छा रखेंगे, योग करते रहेंगे, स्ट्रेस लेवल्स को नीचे ला के रखेंगे, आपका शरीर अपने आप से उस सिस्ट को ठीक करने में लगा हुआ है. भरोसा आप रखो, आपका शरीर आपके दिमाग से ज्यादा इंटेलिजेंट है, उसे पता है क्या करना है. आप बस उसको चीजें देते रहो अच्छी अच्छी. 3 महीना 6 महीना हो सकता है लगे. सिस्ट डिसॉल्व होते हैं, चाहे वो ओवरी में हो, चाहे वो फाइब्रॉइड यूट्रस में हो, चाहे वो एंडोमेट्रियोसिस. इतनी सारी चीजें हैं जिसका हमें लगता है हो अब हो गई, अब क्या करें? लाइफस्टाइल ठीक कर लो, थोड़े से हर्ब्स दे दो और पेशेंस रख लो. 6 महीने 7 महीने, मैं तो कह रही हूँ पूरी लाइफ का अगर 1 साल भी डिवोट करना पड़ जाए तो कोई बहुत बड़ी कीमत नहीं है. और योर बॉडी कैन स्टार्ट ब्रेकिंग ऑल दीज थिंग्स on its own. Okay, this is general advice. Of course, if the size is really big or something, so cysts, firstly सारे cysts cancerous नहीं होते हैं, which is a good news. तो अगर cancerous नहीं है तो अपने आप से ये धीरे 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 करके छोटा होता रहेगा, अगर आप सब ठीक कर रहे हैं तो. ठीक है, मेरे ये मैंने आंसर कर दिया है. हाई बीपी पर्सन कैन ऑल्सो टेक, यस एब्सोल्युटली, बल्कि आपका बीपी ड्रॉप होगा, इसलिए मैंने एक इंग्रेडिएंट के लिए बोला भी था. You can, that those of you who have low BP can avoid kutki because it lowers the blood pressure. So in fact, it's good for you. Okay. How do I know that I must do the detox treatment? So Vijay ji, let's not look at it as a treatment in that sense. Okay, this is like an empowering drink which is giving your liver the resources to act more powerfully as compared to how it's acting right now. Right? It's like if so far it was working on its own, now it has been given 3 more weapons that it can use to be able to work against all the bad things which are there in the system and that it needs to fight. So that's how you need to look at it. Otherwise, in general, if you want to know whether, you know, what are the symptoms which tell you whether you need a liver detox or a treatment, we discussed it in the orientation session. Right? If you can go back and watch the orientation session, just check the symptoms that I have spoken about. If you have any of those symptoms, that means this program and whatever I'm giving you as part of the protocol is going to work for you. Can SGPT, SGOT levels be reduced? 210%. I just gave you examples. So many cases, 100 se upar nikalta hai SGOT, SGPT comes down to less than 30. Less than 40. Okay, can come within range in less than 3 months. So that's why I'm saying have faith, and this is all naturally. With whatever I'm asking you to do, with just giloe and amla and hui amla and all that, your SGOT, SGPT will come down, provided your lifestyle is good. You have to exercise and you have to sleep well, and things will start looking up. Liver detox drink for GERD patient, it's fine, but if, see, it's not that it's going to increase your GERD because quantity of everything is less. But if in your case you think it's creating an issue, please stop. I want to know simple liver detox drink first thing in the morning for fatty liver. So Shalja ji, this is simple only, but if you're finding it complicated, I've already answered. You can go back and watch the recording. That you can just have amla water, no problem. Okay, amla juice diluted in water. Pigmentation problem, LDL, cholesterol is 159. Hair problem, Che, to please advise me. 22-year skin is very dry. So, of course, if you work on your liver, pigmentation issues will also start getting better. Usually, skin pigmentation coming up, even melasma coming up, happens because your pitta is aggravated. We're going to speak about Bhrajak pitta and what are the different kinds of pitta. I've kept it for Monday when I speak about how Ayurveda looks at this, right? So, cholesterol also will start getting better with the drinks that with the detox drinks that I've given you, and other things that will be included as we go ahead. Pigmentation will get better as well, but it takes time. Okay, because your skin and your hair and your nails are your body's last priority. अगर आप आपके जितने भी अच्छी चीजें आप शरीर में डालेंगे, पहले शरीर अंदर की सफाई करेगा, जो सबसे इंपॉर्टेंट है, फिर कुछ रिसोर्सेज बचते हैं, फिर आपकी स्किन पे, हेयर पे, नेल्स पे असर दिखना स्टार्ट होगा, और जब वो दिखना स्टार्ट हो जाए, यू कैन बी श्योर आप ठीक डायरेक्शन में जा रहे हैं. बॉडी के पास इतना रिसोर्स आ चुका है अब कि वो आपके सुंदरता पे काम करने के लिए रिसोर्सेज डेडिकेट कर रही है. ठीक है. I'm a patient of multiple autoimmune diseases. I have been on steroids. Okay, for several years I have been advised not to use unregulated. Yes. So you're right about Giloy. I'm unsure about good question. So if you have an autoimmune condition, a severe autoimmune condition, because autoimmune means your immunity is already on a high and it's attacking your own body. I understand you may be a little skeptical about Giloy. Eliminate Giloy, no problem. What you can still have is Amla. Forget about Bhumi Amla, forget about Kutki, forget about everything. Just have aloe vera and amla, safest to have, and don't have that kind of a spiking impact on your immunity. So it won't be a problem. Like I already said, that if you have autoimmune issues, you should be working on your gut, specifically the intestinal health. And I hope this also starts getting better. So I hope I've answered your question. You can avoid Giloy, no problem. And you are right in your apprehension. Bloating issue will get sorted, Satyanarayana ji. It will get sorted if you keep following what I've asked you to have. I've specifically given a powder, or I don't know if I've given just saunf and mishri. I think we've given ajwain jeera saunf powder also. We've told you the proportion in which you can make it. So start having that after meals, and your bloating issue will start getting better. Okay. Rashmi Jain, good morning. Good morning. गुड एंड छाया, बस अभी आप गुड मॉर्निंग विश करने के लिए आपने मैसेज किया था. गुड मॉर्निंग. शी सो क्यूट. शी स्पेशली सेड डियर दीप्ति एंड यामिनी, गुड मॉर्निंग. ओके. How many food items and how many herbs should we use? There are many items. Rasika, if you've been following all the sessions live, or if you're watching the recordings, I've already told you what you need to do. Please follow the meal plan to be precise and to keep confusions away. Just follow the meal plan. Rest of the knowledge sessions, take them as knowledge sessions. You start becoming smarter about what all is there that you can use for different conditions. You don't have to start doing it immediately. Okay. If any changes have to be made, if I want you to start something immediately or in the next couple of days, I will put it in the meal plan. But my duty as part of this program is to make you much more educated and smart about how herbs are acting on different parts, which herbs has what kind of effect. This does not mean that you have to start having all of them. Okay, look at it as an educative session, which you can use maybe 6 months down the line. You pick up 2 ingredients from what you've understood and you start having that in safe dosages, right? Don't implement anything which has to be implemented. You will be told so that this is there, we've included it in the meal plan, please start having it. Okay, how to overcome autoimmune, I think I've already answered. I'm doing yoga 6:30, very good. I'm taking breakfast at 9 a.m. I want to ask, can I take detox drink before? Yes, absolutely. You can take it. Just leave a gap of at least 20-25 minutes so that the water is not, वो झूले ना खाए आपके पेट में जब आप आसन कर रहे हो. ठीक है. So just leave that kind of gap. Otherwise, you may feel slight nausea. Rest is perfectly fine. Meal plan may be shared again. Back in team, please note. Is dried amla effective as fresh ones? Yes, that's the beauty of amla, that it can retain its vitamin C despite undergoing slight harsh conditions and heat and all also. Maybe not as strong as amla juice, okay, but still amla powder has very strong qualities. In fact, triphala, which is used as a medicine for lots of medicine, or let's say a rejuvenating combination for lots of issues, has amla powder as one of the ingredients. There are different ratios in which it is used. Sometimes it's 3:2:1 of amla, baheda, harad. Sometimes it's 1:1:1. Both are used in different conditions. But my point is that all these medicines have amla powder only. So is it effective? Definitely, very effective. Liver detox kashaya is causing gas and constipation. How can I tweak it? Maybe some ingredients are not suiting you. Like I said, focus what you can do is increase the amount of aloe vera juice from 30 ml to 60 ml. Okay, that should help. Reduce the quantity of bhumi amla also to just a pinch, right? Yeah, and this I think this much tweak should be able to help you. If it's still creating an issue, please discontinue. There is no problem at all. That means your body has a condition where these things are not suiting. It happens sometimes. Request to clarify, what should I do if anyone has high uric acid? So the good part is the detox juice is going to help you with high uric acid as well. See, I can give you a lot of other things for uric acid, but you'll get very confused because there's already so much we've spoken about. Otherwise, Punarnava again helps with uric acid. Okay, Gokshura helps with uric acid, but then it comes down to how much dosage, and other people will have questions. What you need to do is, please know Amla and Bhumi Amla and all these things are anyway helping with it. So just continue with this. Remember not to have too many things which are high in purines. Okay, food wise, that should just sort it out. But give it some time, 2 3 months. Good morning. Combined food schedule for hypothyroidism, fatty liver, grade 2, rheumatoid arthritis. Mary G, not, see, this is a lot of things put together. This will require personal advice, which we will not be able to give here, right? Can we use detox drink during menstruation? Yes, you can. Morning tea, I'm addicted. Shobita, I know this is a little difficult. How to avoid? Little bit of willpower, and I can tell you there is one thing that you can do. There is something known as raw cacao. Okay. Now, if somebody has very high pitta, may not be the best thing for them, but raw cacao is rich in magnesium and has slight chocolatey flavor to it. So, if you can make almond milk in the morning, add a little bit of raw cacao and some dates or figs, anjeer, to it for sweetening, it becomes like a drink which, because it has naturally it is rich in caffeine also, it will give you that morning mental boost, and you can have it slightly warm, so it becomes like a natural hot chocolate. So mostly I do that with clients and it has worked for a lot of people. But कई लोग चाय को लेके इतने लॉयल होते हैं कि उनको चाय से ही मजा आता है, तो फिर तो आपको दिमाग को ही समझाना पड़ेगा. Instead of having it in the morning, every time you get that talab na, that I want to have it right now, tell your mind, I'm going to have it. The ginger is right there, the milk is right there. Kahin nahi bhaga ja raha, I will have my tea. Let me just postpone it by 1 hour. That's it. The day you're able to convince yourself to play this 20-minute delay, 1 hour delay game, and your mind says, okay, we'll go back to it after 1 hour, you'll realize that postponing the consumption of morning tea will become easy. Okay. How often detox drink should be taken? Right now, daily. I've already spoken about it. Can reversing fatty liver help with correcting protein leak? No, Molly. Like I said, these are different things. I think your kidney also has to be looked at. Basin ka question I've already answered. Acidity and masala type smell from stool. Right. Pitta issue. So that means food, there is a lot of heat inside your body, and that needs to be stopped. Okay. So it will start getting better if you follow everything. Also start adding, especially if you don't have fatty liver. Even if you have very little ghee on top of your meals is not a problem. So ghee, good quality A2 cow ghee, pacifies this pitta. So this smell is also going to stop. Is the paralysis? I've already answered this. Get mouth ulcers very often. Is this related to liver? It's related to your digestive health. Very beautiful way one Ayurvedic Vaidya explained this to me. He told me long back when I was still learning things. He said that if your mouth has any condition because of which you're not able to chew, you're not able to eat certain things. Why is it happening? Because the insides of your body are telling you that create condition that this person is not able to put things inside their stomach, unnecessary things that they're putting. So if anything to do with teeth or gums or ulcers are happening, it's your body telling you you need to watch what you are eating. So again, it's a heat issue in the body, acidity issue, which you may not even feel as acidity, but that pitta aggravation has started to happen. Amla usually has a fantastic impact. Even if you go to a doctor, there are two things that they give you, actually three. First approach is ideally, just 1 second. Yeah, first approach is ideally vitamin C supplement and B complex supplement, which is given. So it's believed that vitamin C and B vitamins ka deficiency can lead to mouth ulcers, which is kind of true. So amla se your vitamin C more than what you need, you're getting. Okay, you can start taking B complex also for 15-20 days and then stop it. This should ideally heal. Third, usually what they do is if it's still not going, then they give you an antifungal medicine. Okay, so if that is a problem, then that's a different ballgame altogether. But I've seen very few people get relief by having that antifungal medicine. Usually, when you work on your digestive health and you have cooling foods and your hunger and all starts to get better, there is no digestive discomfort, mouth ulcers get solved. Okay, so I would say आप आंवला जूस लेना immediately start करो and B complex का supplement and let me know in about a week's time if you are already better. For most people, it gets sorted out with just that much. Can we mix amla with curry leaves, beetroot, and haldi in drink? Haldi, no, I'm not a big fan of giving haldi with water. I think I explained this that haldi ka best absorption happens when you are having it with some source of fat, and also because haldi is acidic in nature. Kind of mixing it with fat makes sure that it does not create acidity issue. Okay, but for some people it suits them. So if it suits you, there is no acidity issue, then you can continue. There is no problem. All right, I have started 15-day program. I need to attend marriage for 2 days out of station. Can I take a break? Srinivas ji, I think you can. Backend team, if please answer this later. Whether the recordings and all will be available for him later also. Does consumption of milk result in fatty liver? No, not directly, not at all. But the problem with milk these days is, see, in Ayurved, milk is an elixir. Literally, मतलब आपने कोई पता नहीं पिछले जन्म में बहुत अच्छे काम करे होंगे कि किसी को milk नसीब होता है. Trust me, that's how it's looked at, ghee and milk. But it's so unfortunate that it's so adulterated these days that you are better off not having milk until you have your own cow and you are really taking care of it like your own child. Then the quality of milk is something else. Otherwise, just I would say get off milk as far as possible, especially commercially available brands. Milk thistle and coffee both can help with non-alcoholic fatty liver. So coffee thoda sa na over wo hai. It helps, yes, but if somebody has acidity, no, then coffee is doing a lot of damage. And also, if you're somebody who has high stress, high cortisol levels, then again, coffee is doing more damage. Matlab, there are so many things to help your liver that I don't think coffee is a superfood. West has made it into one, but it's not. Okay. But if you want to have coffee, you have really, really good quality coffee beans and you enjoy having it and you have not much stress, you don't have too much acidity, go for it. It will help you. But it is replaceable, is what I would say. It's not as great as you see social media make it out to be. Okay, that's the only thing I want to say. Also, add a little bit of coconut oil to it so that its acidity factor falls. Right? Milk thistle is also great. You can have that as well. How long the diet should be followed? For a week for now. My liver function test is good. Should I still take? Yes, you can still take it. Breastfeeding mothers के लिए liver detox नहीं. Please don't take it. Alternative, आप आंवला and aloe vera का जूस लीजिए. ठीक है, आंवला जूस, एक आंवले का जूस एंड अबाउट 30 ml to 60 ml तक भी आप ले सकते हैं एलोवेरा का पल्प निकाल के. और अगर बॉटल लेना है तो कपीवा का ले लीजिएगा. Kapiva liver care juice, yes, you can take. How will the meal plan help in autoimmune hepatitis? See, autoimmune is not that there is any problem. Giloy, don't take. Okay, don't take Giloy. Can autoimmune hepatitis be reversed? Definitely. Why not? You have to be patient. You need to have faith that you can be helped. And thirdly, we need to find out why this autoimmune condition has happened. It has come from leaky gut for sure, but what has caused the leaky gut? And now I don't know what you're doing, Dipinji, to help your leaky gut, right? So you need to you need to work on fixing your intestinal health at the moment. I was told there will be a meal plan, but I did not receive. Backend team, please look into this. Can heart patient on medication have? Yes, you can. No problem at all. This is not interfering with any of your statins or blood thinners or anything that you've been put on.
Just one quick reply. In the chat, the link has been pinned for meal plan. Everybody who's not getting access to the meal plan, after the session, click on the link. It's available to everybody. Every meal plan recipe related doubt, it's here on chat. You can continue, Deepti. Thank you.
Okay, I think I'll just take 2 more minutes. My battery is also about to die. I mean, laptop battery. Anjum ji, regarding gallbladder, no, I'm going to do a separate session. Okay, so I'll address everything with respect to what people with gallbladder removal or with gallbladder stones can do is something I'll cover separately. Okay, pigmentation can be reversed by working on your liver, and can weight be gained again by working on your liver. Okay, and hota aisa hai that when you are working on your liver, chances are that you may lose weight in the beginning, but once your liver is fine, then you start putting on by eating a lot of good quality food and exercising. Without exercise you cannot put on healthy weight. So this approach जो फॉलो करते हैं ना ज्यादातर डाइटिशियंस, आलू खा लो, चावल ज्यादा खा लो, weight बढ़ जाएगा because they are rich in carbs. No, this only making you put on fat. You need to put on good quality muscle, for which you need to continue with yoga, and you need to do at least 2 to 3 times weight training, so that, and then give yourself good quality food which is high in proteins. That's how you put on weight. It's a very slow process, but a sustainable process. Grade 1 fatty liver dangerous? No, it's not dangerous, but you must do something to make sure that this grade 1 also gets reversed to zero, and it is doable. 100% doable. I can't source the ingredients for the drink in the country. Is there an alternative? I think Anosha have already spoken. Amla powder you will get. Start having that. Amla and aloe vera also, if you get, you're good to go. Drinks foods that need to be strictly avoided while we are on detox program, and also in future for a good liver. So we'll let you know about that. In general, everything that you already know: sugary foods, refined foods, extremely fatty foods, palm oil, bad quality oil, all of these are things which are bad for liver. Homemade food, everything is great. On top of that, what can you do? I've already told you what are the herbs and what are the foods which are specifically good for liver. We've spoken about haldi, we've spoken about cruciferous vegetables, we've spoken about amla, right? So all of these and lots of other things. If you watch the last session, you'll get an answer to what you are, the question that you are asking. Okay. Can we have non-veg with amla? So amla and non-veg don't have much of a connection, but at Habuild, we encourage having vegetarian food. So even the meal plans that you will find will have vegetarian meal options only. Okay. Can we have this detox drink during Ramzan fasting? Yeah, you can. There is no problem. Just that your BP or your sugar level should not go down too much, because you're not eating for a very long duration after that. Most people will eat, right? So their glucose levels will come back up. If you're going to be fasting, make sure 30 minutes or 20 minutes after this drink, you have a proper meal, so that there is no hypoglycemia. That is your sugar level falling too low. Bloating issue will get sorted with the ajwain jeera soft powder. I have given it in the meal plan. Heavy acidity, always avoided vitamin C. So vitamin C, okay, you're partially right, because most sources of vitamin C are, sour, right? That is why it creates an acidity with you. But start having aloe vera and check with amla. Start having aloe vera and see if that works for you. If it still doesn't work, please, Reena ji, then you need to visit an Ayurvedic doctor. They may prescribe you Mahatiktika Ghritam or other things which will first pacify your acidity. Terribly overweight, no problem. Things will start getting better. Do your yoga daily, start following the meal plan. Okay. Morning detox water meal plan for liver, safe for autoimmune. Remove the giloy part of it. Okay. Don't have giloy, rest is fine. Is the I've already answered. Diet has rice. Should we stop taking it? Okay, what just happened? One second. Suddenly the screen refreshed, and I lost the flow that I was in, which I was answering. Also, we are at 12:30. Yamini, can you come back into the picture and tell me how we can figure out the remaining questions?
Thank you so much for taking so many queries, Deepti. And I completely understand that it might be challenging for every query to be answered. And really appreciate everybody's patience. जितने भी लोग यहाँ बैठकर सुन रहे हैं, really appreciate your patience in waiting for your questions to be answered. But Deepti, will you be able to take more queries, or should we wrap up? कैसे, as you say, I mean, if you have another meeting scheduled, uh, we will request everybody to send them over WhatsApp.
Uh, okay, let me try for 5 more minutes. Whatever I can take, I will. Okay, so 12 up till 12:35,
Sure,
right?
that's all right. Yeah.
Okay. The screen's just going on. I'll have to just get used to the movement of the screen. So what's happening is I'm reading a question and it suddenly keeps going up because I think a lot of people are posting their queries. Hmm? Sorry, 1 minute.
I think if you want to just summarize some common queries, that would also be a good time now. So you can just summarize pointers which you want to, and then we can wrap it up for now.
So I think a lot of questions were firstly around how long and whether it's safe or not. As far as safety aspect is concerned, for 15 days, even up to 30 days, I would say you can safely consume this drink, right? For people who have autoimmune issue or you are on immunosuppressants, Giloy you can avoid completely. Rest of the things are perfectly safe, right? That is not a problem. A lot of you are asking me lots of questions around. See, those of you who are on dialysis and all, you have to talk to your doctor. This chronic kidney disease, dialysis, you need your doctor's consent, especially where you've been told potassium levels have to be under control or you can't have more than X amount of water. Doctor's intervention is required. I can't answer over a group session. Okay, I hope you appreciate that. And rest, I've told everybody that even if you're not, if this is too difficult to follow, just get to amla and aloe vera or just have amla bhi available nahi hai to amle ka powder. Okay, and even that much will, I honestly do just this with my clients, and within that only their SGOT, SGPT, and everything begins to fall. So you can imagine how powerful just amla by itself is. Okay, and some of you will not be able to tolerate amla also. Happens, not your fault. Your body is such, or right now there is a problem because of which the acidity level perhaps are so high कि वो कुछ भी खट्टा नहीं पच रहा है. So then you don't worry. First try having it with food. If it's still not working, forget about it. Just stick to aloe vera and that should be it. And other things that I've told in the meal plan, that will work. Okay. Yes, that's it. And last thing, please don't mind if I've not been able to answer certain questions. Can they send it somewhere, Yamini? Hmm? Can they send
Yes.
it, put it somewhere where we can? Yeah. So your questions will get answered. Plus, we have more sessions coming up. So don't worry about it. We'll have another one next Friday. You can always ask me something. हो सकता है तब तक आपके questions already answer भी हो गए हों बहुत सारे sessions के दौरान. Okay. All right. Thank you so much. Have a
थैंक यू
good day.
सो मच दीप्ति जी. सो इफ यू स्टिल हैव क्वेश्चंस, आप हमारे सपोर्ट टीम को भेज सकते हैं. आप भेजते रहिए अपने क्वेरीज एंड धीरे धीरे वो आंसर होते रहेंगे. वी विल गेट दीप्ति जी टू सॉल्व दोज क्वेरीज फॉर यू. Thank you so much for all the patience, Deepti ji, and also that all the members asking queries. And this weekend, stay consistent, stay strong, don't give in to some cravings or indulge in something which is not part of the plan. However, if you do, then don't feel guilty about it and bounce back immediately right back into the plan. Try not to, but if it happens, it happens. It's fine. uh, we will see you on Monday. हम लोग आपको मंडे को मिलेंगे with next knowledge session. Monday को we will talk about Ayurvedic perspective of the liver, है ना? How liver is the seat of pitta, right, Deepti?
Yes. Very
Yes.
interesting topic for everybody. So do attend.
So definitely, and if you're still confused, don't worry. Join us the next week. If you're traveling somewhere, don't worry. Recordings will be available. If you for later also for up until 1 month till the program ends. And अगर आप कोई भी session miss करते हो, try and get hold of the recording. आप recording देखकर be on track. वापस से track पे आ जाइए. ठीक है? We'll see you on Monday. Bye bye. Thank you so much. Have a good day ahead. Yes, if you have any more queries, please feel free to reach out to our support team. Thank you so much. Back in team, let's wrap up the meeting.